Welcome to HeartCode ACLS, the only AHA-approved, self-directed e-learning program for advanced cardiovascular life support. In a few minutes, you will treat your first patient. But first, I'd like to introduce you to the basics of the program. You will take control of the two rescuers seen on the screen, and you must assess and treat the patient according to the AHA guidelines. When treating the first patient, you should focus only on the BLS algorithm. The tab menu at the bottom of the screen lets you control the rescuer's actions. Each tab represents different groups of actions, examinations, or tests. The first tab, labeled Response, lets you ask the patient questions and check for responsiveness. The airway, breathing, and circulation tabs each contain actions related to these specific areas, such as performing a head tilt chin lift, ventilating the patient, or using a defibrillator. The Examine tab, the Drugs and Manage IVIO tab, and the Lab and Diagnostics tab are not available while assessing the first patient, where the focus should be only on key BLS skills. Finally, in the Miscellaneous tab, you will find various general actions, such as changing the patient's position. Round icons make the rescuers perform actions, while triangular buttons open submenus. For instance, clicking the triangular button labeled Supplementary Oxygen opens a submenu where you can choose how you want to administer the oxygen. Note that the triangular button doesn't perform an action in itself. It simply opens the submenu. In this case, one of the round icons should be pressed in order to deliver the oxygen. Just below the close-up of the patient's head, two time controls are available. The top one is labeled Scenario Time and shows how much time you have spent assessing and treating the patient. The buttons next to the time allow you to pause the simulation. If you want, you can also fast-forward the time. The program will automatically stop the fast-forwarding if there is a change in the patient's condition. Under the scenario time, you'll see the code clock. This is a stopwatch especially useful to time CPR cycles or drug administrations. Use the first button to start the code clock and the second one to reset it. Once you believe you have given the patient the best possible treatment available, you should click the transfer icon, located in the lower right corner of the screen. This will let you choose from a range of possible patient transfer options. Select the one you feel is the most appropriate to end the scenario. That's really all you have to do to treat your first patient. First, control the rescuers and go through the BLS algorithm by using the buttons in the tab menu. Second, when you believe that you have given the patient the best possible treatment, select the Transfer Patient option in the lower right corner of the screen. Good luck with your first patient.